I'm here with Margaret Flowers, a pediatrician turned single-payer activist. In 2009, she was arrested at the Senate Roundtable on Healthcare for trying to get single-payer into the discussion when it had been cut out. Ever since, she's been working on the issue, and she joins me as we are, well, anticipating a verdict from the Supreme Court on the Obama healthcare plan, the Affordable Health Care Act. Margaret.
Yes.
Where do we stand right now? A lot of the media would have you believe that we're kind of on the brink of the apocalypse.
Where we stand right now is there's kind of two things that we really need to consider. One, of course, is the decision around Medicaid. And this is a very important decision. I think this is much more crucial, is if the Supreme Court says that federal government's giving states money is tantamount to coercion, that's a real problem, because where does that end? I mean, if the federal government says you must meet minimum guidelines for education and we'll give you money to help your schools, is that coercion? We really rely on government to provide a basic social infrastructure that takes care of people. Now, the individual mandate, if that's found, I mean, really with the individual mandate, no matter what happens, if it's found to be constitutional or not constitutional, we know that the bill didn't go far enough, and the single-payer movement is going to be continuing to push for national Medicare for all. If it's found to be unconstitutional, that provides us maybe a better opportunity to make that argument and say, okay, you've done everything that you could do within the private insurance, framework. It doesn't work. Now, can you really see the facts and see that we need to build a publicly financed system that's accountable to all people and universal?
Let's talk about the individual mandate. In one of the pieces you co-wrote recently, you referred to it as crony capitalism on steroids. What did you mean?
Right. The individual mandate requiring people to purchase private insurance and using hundreds of millions of our public dollars that go directly to the private insurance companies is outrageous. If you look at it, people having private insurance still doesn't guarantee that you can see the doctor that you need to see, get the treatment that you need to see, that you can afford the health care. Because of copays and deductibles, many people are foregoing necessary care, even though they have insurance. And then if you look at, doesn't private insurance protect you if you have a serious illness? The greatest cause of bankruptcy is a medical illness, medical costs. And 80% of those people that went bankrupt from medical costs had health insurance. So we're forcing people to purchase a defective product. We're putting our public dollars into a private corporation that's just going to take that money as profit and not give it out to the people for care.
So the Supremes should vote it down?
I believe the Supreme Court should vote down the individual mandate. It's not a solution. It's not working in Massachusetts. Very clearly they're failing. People are still facing serious barriers there. They say they're worse off than they were 5 years ago. So that should be the answer right there. It doesn't work.
Now, Howard Dean, speaking recently in Washington, said that he didn't give a damn, his words, about the individual mandate, but he did think there were things to preserve in the act. Mm-hmm. He talked about 30 million previously uninsured Americans getting insurance, getting covered. Mm-hmm. He talked about 17 million being added to Medicaid if the program exists for another couple of years. Mm-hmm. Tax credits for people who can't afford it. Mm-hmm. Again, kicking in 2014 if the act as a whole survives. Mm-hmm. Do you agree that there are parts of it that are worth saving?
Well, this is the dilemma that we're always placed in, where there's a little bit of good for some people, but if you step back and look at the big picture. So for one thing, the 30 million people that will gain insurance, what are they actually gaining? About half of those will be given Medicaid. Medicaid is a system that doesn't work very well. It's hard to find providers. People are not treated well when they have Medicaid in many cases. They're kind of shifted out of the hospital pretty quickly. The other half is going to be getting private insurance, and with the copays and deductibles, they'll still face serious financial barriers to getting the care that they need. They'll still face bankruptcy if they have a serious accident or illness. So we're leaving still 20 million or so people out. We're expecting under this legislation, the recent data shows that maybe 20 million employees will lose their employee benefits under the Affordable Care Act. So we're not really moving in the right direction, and so there's always something good in there which causes people to defend it without looking at the big picture that too many people are going to be left out. You know, when Obama was elected, I was optimistic, like many people, because he knew what single payer was. He'd been on record saying that single payer was the best solution. We thought we would at least have a discussion, a debate of looking at, you know, what were the possibilities. It was quickly very clear that this was not, that this was a predetermined course, that it was more like a marketing campaign. It was very scripted towards a predetermined end. And that was what was very upsetting to those of us who advocate, you know, for real health reform, evidence-based reform, Medicare for all.
Nonetheless, a lot of people got very involved in the campaign. What's your message to them today as they wonder what's going to happen? And many of them feel they worked very hard for something that they don't want to see thrown out, far less told it was all useless.
I know this is difficult for people that worked really hard to get the Affordable Care Act. And for me personally, I think it's really important to be honest. And the truth is that the Affordable Care Act was something that was heavily influenced by the industries that profit off of our current situation, doesn't address the problems that we have. And that now we've seen that we have an opportunity. If the bill is not, you know, if it's brought down or the individual mandate is found unconstitutional, we have an opportunity to push for real health reform, to come together and stand independent of political party. One sign I saw that was beautiful was "Get your politics out of my health care." That's what it's really got to be about. Let's all come together and fight for a really top-notch health system in the United States that serves everybody.
So who would be the we in this case?
Well, it's interesting because at the same conference where Howard Dean said he didn't care about the individual mandate, Representative Keith Ellison said, if the bill goes down, we immediately must pounce on this opportunity to go out there with the Medicare for all and say that this is what we want to have. And the majority of Americans already support that approach, the majority of physicians too. So this is a real opportunity to clearly define what we as a nation would like to see happen.
Has the movement around healthcare changed in these years?
The one positive that came out of the 2009-2010 health reform process was that the movement for real health reform, for single-payer Medicare for all, became much more organized and much larger, with groups all around the country in most states who are advocating for this. So I think that they'll be ready to mobilize when this opportunity arises.
What do you think you'll be up against in the form of the lobbyists and the corporations that put $100 million into trying to stop even this act that you think didn't go far enough?
If we're pushing for single payer, we're always up against the big dogs, the one that are profiting off the current situation. But one thing that's happened, I think, with the advent of the Occupy movement is that people are more and more looking at the truth behind this, seeing the corruption of money in our political system, seeing the corruption of our corporate media and how they really serve the political interests instead of the people. And there has been a growth of independent media. We need much more growth in that area. But I think that all of those are real positives towards pushing, exposing the truth, pushing for what we really want this time.
A lot of the media discussion is about the political implications of this decision. I want you to talk about the personal implications for a minute. For the people that you would like to be caring for as a doctor, where are we right now in terms of giving them care, and what's in the balance?
Right, the politics of the healthcare decision are something that I've never really paid attention to. That's not important to me. What's important to me are the patients that we see every day, that I saw when I was practicing, that my colleagues continue to see. We don't want to turn anybody away. We don't want to have to ask them if they have insurance first or if they can afford their copay before we see them. What we see in the United States, we're ranked 37th in the world, which is ridiculous because we spend twice as much per person on health care as any other industrialized nation. And those nations cover everybody and they have better health outcomes. We see that tens of thousands of people are dying every year of preventable causes simply because they don't have access to care. The #1 cause of bankruptcy in the United States is due to medical illness or medical costs. That doesn't happen in any other industrialized nation. They think that's crazy that people are facing that. So what we really need to do is talk about that, talk about the patients. The bill, the Affordable Care Act, does help some people. It doesn't help them as much as it should. And what the kind of politics does is it takes those people. We saw this when the Supreme Court was hearing the decision, that there were all these signs saying, you know, fight for women's health care, fight for children's health care. And so they pit people against each other saying, well, we have to save this because it's going to help this group. We want every person to be helped, and that's what a national improved Medicare for all would be. Every single person would be in. Nobody would be left out. That's a system that we can build on. We're hoping that we can develop a campaign if the law is found not to be constitutional. That's very simple. Drop 2 words. If we just took over 65 out of the Medicare bill, then it's there for everybody. Now we have something that we can tweak and make better.
What can people do if they wake up after the Supreme Court decision and want to get involved in this movement?
I think very important to contact their members of Congress right away and demand a Medicare for all. Very simply, drop those 2 words. Let's expand to Medicare to everyone. That's the fastest way to do this. And then they can check out our websites, PNHP, which is Physicians for National Health Program, has a lot of educational materials. It's pnhp.org. And then Healthcare Now is really the grassroots base. They're kind of sister organizations. And so there are Healthcare Now chapters all around the country. It's healthcare-now.org. And they can get involved.